My name is Alicia. I'm a registered nursing student at Northwestern State University, and I'm part of your healthcare team today, okay? Is that okay with you? Alright. I'm here to put in a catheter for your fluid retention you're having. Okay, if that's okay with you. Okay. Can you tell me your name and date of birth? Alright, I'm just going to confirm on your armband. Okay. I provided my patient with privacy, confirmed the physician's orders, and gathered all the necessary supplies. Ms. Hickman, I'm going to move my badge down here so I don't break sterility with my badge. Okay. Have you ever had a catheter before? No? Okay. I'm going to walk you through it. I'm raising the bed for now so it will be easier on me, that don't hurt my back, and I maintain sterility while I'm doing it. Do you have any allergies to latex, betadine, or adhesives? No? Okay. Alright, so I'll walk you through each step as I'm doing it. Okay. First thing I'm going to do is I'm going to lay this blanket over you so you can stay warm and for your privacy. Okay, if you could just hold the top right there, I'm going to pull this down. Okay, and what we're going to do is I'm going to put you in the dorsal recumbent position, which is your knees bent and your feet on the edges of the bed. Okay. All right. All right, so I'm going to start with cleaning the area before I insert the catheter, okay? Does this warm soapy water feel okay to you? Okay. Okay, so you're gonna feel the wet liquid as I do this, okay? Front to back, Paracare has been provided. Okay, now that that's done, I'm going to set up my sterile field. I'm going to use this bag as my trash can to drop everything in. Okay, I'm going to open it first flap away from me, being careful of my 1-inch margins that I can touch. I'm going to make sure it does not touch the bedding or hang off too much. We're going to ignore that that is wet. It would not be wet if I was really doing this on a patient. That would break sterility. Okay. It should not flap back over on it. Sure it doesn't move too much where it doesn't touch my sterile field over there. Okay, now I can fix this. Okay, first thing I'm going to do is I'm going to lay this down to be my new sterile field on your bed, okay? It's going to be shiny side down. I'm going to walk you through the entire procedure, okay? All right. I would open my swab sticks away from my sterile field. I'm going to place some lube in the container so I can loop the tip of the catheter. I'm going to take the sheath off of my catheter tip. And I'm going to connect my sterile water. Okay. Okay. The first thing you're going to feel is some cold swabs, just me sterilizing the area before I insert the catheter, okay? Alright. Going to clean one side, making sure not to reach over my sterile field. Other side. And then down the middle, looking for the wink. I'm going to lubricate the end of the catheter. All right, while I am inserting this, what I need you to do is I need you to bear it down like you're going to void, okay? All right. We're going to stick this in 1 to 2 inches until we see urine output, and then another inch. I'm going to inflate the balloon, okay? You're doing great. Make sure that that is in there. Now the sterility of it is done. All right, I'm going to put this over the leg. I'm going to tape it to the inside of the thigh. Leaving plenty of slack so it doesn't pull on it when the patient moves around. I'm going to note the color, the clarity, and the amount. I got approximately 400 milliliters. The color's pale yellow and it's clear. I'm going to put the time, the date, and my initials on the back. I'm going to attach it to a non-moving part of the bed. Okay, you did great. Do as I move all this out of your way. If I were to use betadine when inserting it instead of the swabs, I would wash my hands, don gloves, and do pericare again. Okay, we're gonna put your legs down and get you covered back up. Now what I need from you is to make sure that you increase your fluids so you're having plenty of urine output, okay? And you're gonna make sure it stays below your waist level. And you're gonna make sure that the bag does not touch the ground, okay? So that will get contaminated. I'm gonna put your bed down. Do you have any questions for me? No? Okay, I'm gonna give you your call bell. And I'll be back to check on you, but if you need anything, just let me know, okay? All right, bed is all the way down. Okay, bed's all the way down, just let me know if you need anything, okay? All right, putting it in is over. We are gonna take it out. I'm a registered nursing student at Northwestern State University, and I'm a part of your healthcare team today. I'm in here to take your Foley out, if that's okay with you. I know, very exciting. I provided privacy for my patient and checked the physician's orders and gathered all the supplies that I need. Can you tell me your name and date of birth real quick? Okay. I'm just gonna check your armband, make sure it matches. Great. All right, so I'm gonna put your bed up while I take this out. So just like the insertion, I'm gonna walk you through the entire procedure, okay? Okay, put this down. Okay, with my gloves on, the first thing I'm gonna do is I'm gonna empty the bag. I'm gonna note the clarity, color, and amount. So I'm going to take one of these pads and put it on the floor. Take my urinal and empty it. I have approximately 600 milliliters. It's clear, pale yellow. Alright, so now we're going to empty that in the toilet. Okay, so just like the insertion, what we're going to do is we're going to put this blanket over top of you for your privacy and warmth. So if you could just hold the top of that, I'm going to pull this blanket down. And same position, we're going to lift your knees and move your feet to the edges of the bed. Okay? To protect your bed, I'm going to lay this down. Okay. Now that the bag is empty, I can take it off and carefully take the tape off of your thigh. So during this part, what I'm gonna want you to do is take a deep breath, okay? I'm gonna start with deflating this balloon. Okay, now deep breath in and out. Good job. Okay, the tip is intact. All right, we will move this out of the way. If I were to need to do any pericare at this point, I would do it. We're gonna move your legs. I bet you feel better, don't you? Okay, I'll take this one and give you back your blanket. Okay, so now that your catheter is out, what I'm gonna need you to do is to call me the first time you go to urinate, okay? We just need to make sure that your bladder and your urethra is working like it should after being catheterized. Do you need anything from me? No? Okay. I'm gonna give you your call bell. Put your bed down. And I'll be back to check on you, okay?